Mr. Robbins, you may call the meeting to order.
I would like to call to order the meeting of the Insurance Benefits and Ledge Committee for Thursday, the 15th of July, 2021. Turn it over to you.
Thank you, Chair Robbins. This meeting is being conducted virtually, so I will do a roll call of the trustees to confirm attendance. Mr. Knox,
I'm here.
Mr. Santos,
Here.
Ms. Gray, Mr. Bernstein,
I am here.
Mr. Oakham,
Here.
Mr. Moore,
I'm here.
Mr. Kehoe, Ms. Zapanta, Mr. Pryor, Mr. Harris, Chair Robbins.
I am present.
Staff participating in the meeting includes CEO Santos Kryman, Deputy CEO Louis Lugo, AEO JJ Popowich, Chief Counsel Stephen Rice, Legislative Affairs Officer Barry Liu, from Retiree Healthcare, Cassandra Smith, Director, and Kathy Magida, consultants Stephen Murphy, Paul Sadro, Richard Ward, Michael Zito from Siegel. Trustees, please use the Zoom chat option to be placed in queue. At this time, we ask all meeting participants to mute your mics until you are ready to speak, and we may now proceed with the agenda.
Thank you very much, Terry. Item 1A, approval of the minutes of the meeting of June 10th, 2021. I need a motion.
So moved.
Are there any motion and a second? Are there any changes, any amendments? Seeing none, you want to call the roll, Terry?
Ms. Gray? Mr. Kehoe? Mr. Oakham?
Aye.
Chair Robbins?
I am an aye.
The motion passes unanimously.
For now, on item 2, public comment. Is there anyone from the public wishing to address the committee?
I have nothing.
Thank you very much. We will move on to item 3A, recommendations submitted by Cassandra Smith. That the committee recommends the Board of Retirement approve an extension of the retiree healthcare benefits consulting contract with Siegel for the period of July 1, 2022 through June 30th of 2024. I'll accept the motion.
So move it.
Second.
And we have a memo in the packet. If anyone wants to discuss the item, now's your opportunity.
This is Keith. I had a question. I was just going to wait and see if any of the members had a question before I did. Okay. Just in terms of the contract extension, were there any extensions available in the contract, or was the term is ending?
The term will be, I'm sorry. Good morning, Mr. Chair and members of the committee. The contract would be terminating as of June 30th of 2022, but because of some of the major projects that we have going on, it's critical that we have a firm that is familiar with our program since it is rather unique. And so therefore, I'm recommending that we request the board to approve an extension.
And is this a contract that we always have, you know, at all times, or is it was just for a set period just to do certain things and we're extending it just to finish those certain things?
Well, it's almost time for us to renew our consultant contract, which is what we're speaking of. Back in 2016, you may recall that the board approved Siegel as our consulting firm for the healthcare benefits program. Historically, the retiree healthcare program, the Board of Retirement has always utilized insurance consultants to assist and guide us with our healthcare program, with the renewals and plan design, et cetera. Those are the same terms that would apply under this extension. The same rules and everything, the same agreement all applies. We're just extending out the contract 2 years. And then we would go back through the RFP process after knocking out some of these projects that we're working on.
And then out of curiosity, why did we not anticipate the end of this contract and resolicit, begin the resolicitation process a year ago or so?
It would have been, we would have been starting that RFP process right about now, but given some of the major projects that we're working on, the first one mainly being the lifetime maximum, we feel that it's better that we have a firm that's familiar with our program that would be able to better assist us in doing statistical numbers and a review of the benefits to work along with the county with us.
Okay, yeah, just my concerns from the past have been the number of evergreen contracts, and I'm not taking away the importance of this or any of the justification that you provided. I think our documentation ought to be a little more clear and talk about what our process is going to be and when we anticipate, issuing a resolicitation, et cetera.
Yeah, as I stated in my memo, I did state that we would begin the RFP process prior to the ending of this extension, which would be June 30th of 2024.
Okay, thank you.
Any other questions?
I'll go ahead and make the motion.
We already had.
I just have, we already had, thank you. And then I just have a general comment that I think in the future when we discuss contracts, specifically about consultants, that we ask the consultants to recuse themselves during those discussions. So just for further FYI for staff on ongoing discussions or future discussions. Other than that, I'm in support of the motion then.
Any other comments? We have a motion, we have a second. Terry, would you call the roll, please?
Ms. Gray,
Thank you. I was actually trying to make a comment, but I was muted. Just very briefly, I wanted to say that the services that Siegel Consulting has provided us has been very, very beneficial. And I think that just extending this contract during your special projects, Cassandra, I think is very important. And I believe when we recruited Siegel Consulting, there really weren't any other consulting firms out there that could do what we could do other than Aon Hewitt, who we had just terminated their contract because it expired. So at this time with COVID, all of our special projects, I think it is a good idea to extend it. And if we were to have had an RFP again, we'd probably be going through the same process and would end up with Siegel Consulting. So I think this is a good motion and I support it, and my vote is yes.
Mr. Kehoe,
Any other comments?
Aye for me.
Mr. Oakham,
Aye.
Chair Robbins.
I'm an aye, and I agree with everything that Vivian said. It's really a very thin landscape out there when it comes to consultants that do this kind of work. Unfortunately, for whatever reason, that's the way it's been. So I think this was a smart move. And the motion passed. So we will now move on to item 4A, engagement report for June of 21. Mr. Liu, do you have anything?
Yes, good morning, Chair Robbins and committee trustees. Just some items of interest for you this month. The first one concerns the Public Policy Institute of California. So they do their periodic surveys about Californians and their government. Those are very interesting surveys. Sometimes they do talk about pension issues, although not in this one. But given that we've gone through this, kind of lost pandemic year, the survey talks about issues at a state and national level. So as far as on a state level, we all know that Governor Newsom is in the midst of a recall, but according to the survey, about 55% of Californians do approve of his handling of his job, and 64% approve of his handling of COVID. And amongst likely voters, only about maybe 40% would vote to remove him from office, with Republicans more likely vote yes. And then California's, no surprise, named jobs, the economy, and COVID-19 as the top issues facing the state, given what has gone on the last year. Although more than half of them say that California is going in the right direction. At the same time, they also feel that the state is in a recession. And then regarding personal finances, fewer than half of adults rate their situation as excellent or good. And compared to a year ago, only about 20% say that they're better off. As far as inequality is concerned, about 62% think that the gap between the rich and the poor is getting larger. At the same time, about 65% think that the state government should be doing more to try to reduce that gap. 36% say that the state budget situation is a big problem. And now, as far as what that means, I'm sure you've all heard about our budget surplus and things like that, but I think this question relates to priorities because overwhelming majority favor either assistance with overdue rent or utilities. And also, as far as stimulus checks are concerned, 70% of adults favor more stimulus checks, at least coming from the state. So on a national level, about 2/3 of Californians approve of President Biden's job performance, and 3/4 approve of his handling of COVID. For the Speaker Nancy Pelosi, about 50% of adults, approve of her, and 45% of likely voters. For Minority Leader Kevin McCarthy, a little less, 32% of adults approve, and 24% of likely voters approve. As far as going in the right direction, a little more than half of Californians think the U.S. is going in the right direction, and about 55% are optimistic that the good times are going to happen financially in the next 12 months. And then, just some concluding points here. I think about 6 in 10 adults and likely voters have a favorable opinion of the Affordable Care Act, and a majority of adults are in favor of guaranteed health care, although only about 4 in 10, less than half, are in favor of that if it means raising taxes. The next item concerns the Society of Actuaries study about financial perspectives on aging and retirement across the generations. That's, I think, in the last few years has always been an interesting topic, given the retirement of baby boomers, the rise of the millennials in the workplace, and so forth. But here, they give a list of top 10 findings. They're kind of all over the map here, so I'm not going to go through all of them, but I'll just let you kind of read them yourself. But a couple of points would be, as far as the financial impact of COVID-19, about 36% say that the pandemic has negatively affected their financial situation, whereas 14% say that the impact was positive. And I think a lot of that is due to whether someone was able to work from home or experience job losses as a result of the pandemic. I think another interesting item here is about 2 in 10 experience changes in their living situation, with housing being the more common change among younger generations. So certainly you've seen younger people move back home as a result of job losses. But otherwise, again, it's just very interesting factoids in this study that they did. And then the third item concerns Gen X. I think a lot of focus has been put on the baby boomers and the millennials, but this was a recent survey about perceptions of Gen X on retirement. And it seems that maybe in keeping with some of the stereotypes of the gloominess of Gen X, they seem to have the gloomiest outlook about their retirement prospects. So only 62% believe their retirement savings are on track, as compared to 76% of millennials and 68% of baby boomers. And then on the flip side of that is they're also more likely to report that they're not on track. That's about 13% of Gen Xers versus 8% of millennials and 11% of baby boomers. Some updates about state-run IRA. So as we've seen, more and more states each month seem to be moving in that direction. Maine just signed into law something that will create a state-run IRA. And then more interestingly, North Carolina is also passing a bill on this. So I think so far we've seen mostly blue states have been starting these programs. So it's definitely interesting to see North Carolina go in that direction as well. And then Delaware is also creating a program that would help expand retirement access. And then some updates about other retirement systems. So the Milwaukee pension system starting a task force to deal with their unfunded liabilities. Apparently, they're going to require annual payments of $77 million starting 2023 to fully fund its pension system. Now, their pension is funded at about 80%, which is generally considered a healthy-ish percentage, but it seems that their city charter mandates that it be 100% funded. So hence some of the financial pressures to reach that goal. So the task force is expected to release a report of its approaches, looks like by mid-August. And then last items regarding pension reform. A lot of times we hear about pension reforms reducing benefits. It seems like this is a potential rollback that some New Jersey state lawmakers are trying to achieve. Apparently, a certain tier in their program was closed to prosecutors that they're trying to reopen because apparently it's affecting recruitment and retention. So it'll be interesting to see if that can be rolled back or not. So that concludes my report, and happy to take any questions.
Anyone have any questions? Seeing none, we will move on to item B, staff activities report. Cassandra?
Yes, Mr. Chair. This report is mainly tying in the last bits of our renewal process, such as updating our IT tables and make sure that the correct premiums are being paid by both the members and the plan sponsor, updating our communications to reflect the updates that took place for this 21-22 plan year. And then we mailed out the out-of-state rate booklets, which usually comes at a later time due to the approval process. And that's it.
Thank you very much. Anyone have any questions for Cassandra? We will move on to item C, claims experience. Mr. Murphy.
Good morning, everyone. And again, thank you for your consideration earlier this morning. It's been our privilege to serve and look forward to continuing to serving LACERA and its members in the future. So thank you for that. Quick recap of the experience. So again, as you know, the first page is basically a quick overview of distribution of enrollment by plan and monthly premium amounts. No significant changes here to review. With respect to kind of recent changes based on the most recent 12 months of activity, Anthem was up slightly, about 1.2% over the prior 12 months. Cigna, which is we've noted as a very small population and subject to a great deal of fluctuation and significant claim activity given the mature nature of that population. Year over year, there was a 19% increase there, and we'll see some of that show up in the large claim activity. And the Kaiser report is similar to the one we looked at last month. It gets updated on a quarterly basis, but they were down about 9.3% compared to the prior year, and a lot of that is due to the COVID-19 suspension of services. This page is a quick recap of the various changes with relationship to the Anthem plan. So again, you can see everything is really within a very tight range in terms of change prior period over current period. So it's good to see. With respect to Kaiser, again, this is data that's through March. Again, probably the only point of interest is the current period, which is the first column, is from April 2020 through March of 2021. So clearly right in the bulk of kind of COVID pandemic. And what really stands out is the outpatient claims per member. Those were down 21% compared to the prior year. And outpatient visits per 1,000 were also down by about 13%. So again, if care could be postponed, it was. If care was urgent, Kaiser was able to deliver that on an inpatient basis. This exhibit, again, provides a highlight or overview of large claim activity. And so as we noted, pretty moderate for Anthem. So significant spike year over year for Cigna, and then actually a decrease for Kaiser period over period. So a little less worrisome on the Kaiser side. For prescription drugs, we've noted the fact that LACERA benefits from pharmaceutical rebates, which help to offset overall expenses. And compared to the prior period, rebates on a per retiree per month basis were up by about 3.2% with the prior period. And the last exhibit on the experience is related to the dental and vision plans. So we're starting to see an uptick in the dental plans, which is certainly an area where care can be postponed for a period of time until it's required. So we're seeing an uptick there, but not significant. And the vision claim still seems to be suppressed relative to the prior period. So we'll see how that evolves over time. But that's the extent of the experience report. Are there any questions specific to the information we've shared so far?
Anyone have any questions?
Just quickly.
Yes,
on
oh, go ahead,
Sorry, go ahead, Lon.
Keith, I'm sorry. Go ahead,
I was
Keith.
just going to ask quickly, dental and vision are the types of things like you mentioned that people put off during the pandemic. So we would expect to see a pretty healthy, not surge, but recovery of those types of costs in the near future.
I'd say recovery is the appropriate term for that. Vision is going to occur once a year. So if I've missed a cycle, we might see an immediate upswing, but I can't do more than one a year. So we'll see that fairly even out. On dental experience, we will see more activity for those that needed urgent care. I think what we've seen both for LACERA and our other client base, when care is absolutely needed on an urgent basis, it was received during the pandemic. But for those that could postpone treatment, they certainly took that opportunity. We may see an uptick, but overall capacity is still the same. We have a finite number of providers, so I don't think we can kind of expect to see a surge well beyond what normal capacity would be.
Thank you.
I have a question.
Go.
Okay, have you done any kind of assessment or preliminary anything around the Medicare changes that are in this reconciliation bill, in particular, including dental, vision in the Medicare package?
In original Medicare, no, but there certainly is a movement afoot to continue to emphasize the expansion of products and resources like dental and vision through the Medicare Advantage program. And we are seeing a continuation of that. So for members that are seeking that, particularly on an individual basis, that is an excellent opportunity for them. And the providers on a regional basis would be very different, be it California or elsewhere. So does that answer your question?
I'm looking at what does it do for the dental and vision programs that we have that are being made available to retirees if it's going to be repackaged and become a part of their Medicare?
Excuse me.
I mean, for
don't think
example,
could-
right
go
now,
ahead.
I pay for my dental care. I'm retired with the city. I pay for my dental care separately. But, I have the Advantage plan with Kaiser that takes my Social Security Medicare payments and includes it in my package, but it doesn't include dental. So I pay for that separately. So when Medicare includes dental and vision, wouldn't you expect that to have some impact on what your plus 65 retirees are getting and, versus the current situation?
Sure. Yeah, I think if it's an opportunity for someone that's qualified for Medicare to receive dental and or vision through their Medicare Advantage provider, that would certainly be an option for them. And if it was, appropriate and cost effective, that could depress or decline the current enrollment that we do have in those programs.
Yeah.
But we'll have to see how that transpires.
Okay. Well, I just
Appreciate the
wanted to know if you were keeping an eye out for that. Okay.
Well, if I wasn't before, I am this morning.
All right.
Stephen,
My 2 cents on that whole
Oh,
issue is that
yeah.
it probably has no effect on us much at all. Getting back to Mr. Knox's comment, remember, Keith, that we have an annual amount of benefits in that dental plan. And while the dental plan use may go up, it's going to be at the expense of those of us that have 2 root canals instead of 1. When we get 4 cleanings a year in our plan, but if you have a root canal, you can still get 4 cleanings, but you're going to pay for them. So remember, we have an annual, $1,500, Cassandra, is all we get in benefits. So I don't see that delayed use of dental benefits is going to have much of an impact on those premiums that we're paying. So because the annual is, frankly, it's way too low, but it is what it is. And we obviously know we can't go in and change that stuff.
I see. Thank you.
Right.
I had one question for Steve.
Yes.
the Cigna premium is 745,000 and the number of retirees is 407, but it's up about a little over 19%. How would that affect the premium, for renewal, as this thing keeps on rising? Because those retirees are getting older and older.
Yeah, the Cigna population is very interesting. And I think for those that have a kind of historic background in healthcare in Southern California specifically, Cigna is essentially the old Los Rules plan. A lot of county employees and even city employees basically migrated to that. So to your point, it is a very mature population. The population is shrinking. It's not going to change. And so from an underwriting perspective, again, at this point, it's essentially kind of pooled with other plans. Its own experience is not very credible. So we'll kind of ride through that and see where that goes. But I think that the expectation is that, again, that population is going to continue to decline. And unfortunately, the expenses associated with those declining members is going to continue increasing.
Okay. Yep. Okay. Thanks, Dave.
Well, thank you. Any other questions on that?
Moving along, Steve.
From a legislative perspective, I wanted to bring a couple items to the board's attention, the committee's attention. There are a number of things going on kind of afield through federal legislation that I think will have a trickle-down effect on LACERA membership, but there's nothing that LACERA has to do. Most of this is going to fall on its fully insured vendors. One is the No Surprises Act, which is for members that perhaps go to a provider but receive a bill from a non-network provider. And they're charging exorbitant amounts. So at this point, the legislation is going to kind of level set that so the member would never be responsible for more than the in-network cost. And then the provider and the insurance company will work through a arbitration or other process to ensure that the member is not balance billed. But that's something you'll probably hear a lot about in the news, particularly over the next couple of months. It will be effective on January 1st. And the next item too is related to that, which is an effort towards creating transparency of costs and fees. So that will impact both healthcare providers, hospitals, providers, physicians, as well as prescription drugs. So a lot of that information is going to be gathered. There was some recent requests for information from plan sponsors across the country by the federal government to try to understand what obstacles may be in place to deliver this type of information. So as an example, what are the top 50 brand prescription drugs dispensed for a particular group or insurance company like Anthem? What are the top costs in terms of increases over time? And the government's looking to use that information to benchmark where costs are going and where there might be a kind of bottlenecks in the system or obstacles to reducing cost overall for membership. So again, nothing that the committee or the board needs to do at this point in time, but just be aware of it in the event that you're asked by LACERA members.
Anything else, Steve, on those?
At this point, no.
Anyone have any questions regarding all of that for Steve? Seeing none. That would bring us to items for staff review.
I have nothing to report.
Good of the order. Mr. Kehoe.
I have nothing.
Mr. Knox.
Always appreciate learning stuff. Thank you all.
Mr. Moore.
Oh, I'm good.
Ms. Gray.
Have a great day, everybody. Thank you for Siegel Consulting Services and look forward to working with you for another couple of years. Thank you so much.
Mr. Kryman.
Nothing for me. Nothing to add. Have a great day, everyone.
Cassandra.
I have nothing further.
Mr. Liu, anything to add?
Yes, actually, just a quick note. Some of you may have seen AB 826, a recent bill that was, I guess, that was put out in response to the Alameda decision. So we're discussing that internally and anticipate giving the committee an update in the August meeting.
Thank you. Mr. Bernstein.
Good meeting. Glad we're going to have Siegel around for a while longer. Look forward to that. And Hope everyone's enjoying the summer days.
Oh, yeah, I just have one comment. Yesterday, I saw the article about the CalPERS settlement on their long-term care plan, $2.7 billion paid out to several thousand of their members and that who have been enrolled in their long-term care. They're going to receive $35,000 to $50,000 each in compensation. So thank you, CalPERS. Just another example of how you screw stuff up and how you make it for all of us. They never fail to disappoint. With that, I don't have anything else. I think we have concluded our business unless Mr. Ward wants to say anything from Siegel. Richard, nothing?
I'll just say that's not the official position of LACERA opinion of CalPERS. So just to clarify, it's a personal opinion. Avoid the news reports
That's
there.
my opinion at CalPERS. So yeah, the guys have brung everybody to the dance. Yeah. There's money to pay for 3 at 50 in perpetuity, right? It'll never cost local governments any money. Anyway, I'll accept the motion to adjourn the committee meeting.
So moved.
So moved.
Thank you. We are adjourned.